Hi, this is your Houston Chiropractor Dr. Gregory Johnson, and we have Jennifer down here with us today, all the way from Ohio. And they drove down here, right?
Yep.
Yeah, how long of a drive is that?
17 hours.
17 hours. That's a long haul. So Jennifer is in to see us today because she has been told by her orthopedic group that she needs to have back surgery due to a workers' compensation injury that happened back in March of 2017 when she was bent over lifting up a heavy crate of material and injured her lower back at that point in time. Well, she brought her diagnostics in, and even though there is no visible evidence of a frank herniation with a fragmented disc, she still has disc bulging down in the lumbar spine, which is impinging on the nerves that come out in through her SI joints and all the way down into her legs. And it's especially bad on the left side, down into her left SI joint that goes down into her left leg. And she's feeling pain all the way down into her feet bilaterally. So she's got bilateral lumbosacral radiculopathy going on. She's also been getting compensatory changes up higher in her spine with stiffness and soreness in the thoracic spine region and all the way up into the cervical region. And she's had a lot of knee pain since this has been going on too, right?
Yeah, that just started.
And we checked her out and did all the testing on her already, did her history and examination. She doesn't have any bladder bowel dysfunction or foot drop. So I told her this is a great viable alternative to doing more invasive procedures such as lumbar spine surgery, of course. So we're going to see if her visit down here is worth its weight in gold like most people's is, and then they don't have to have spine surgery. And that's what you're actually after, right?
Yes.
To get feeling better naturally without having all these invasive procedures.
Yes.
Okay, so I'm going to have you close your eyes again, and we're going to have you bend your head forward and backwards. I already know the answer to this. We're going to show our YouTube audience. And back to neutral. Now, one thing you can tell about her is that she's a side sleeper most of the time because her head is forward and translated over to the right just a bit. And I don't think that occurred in her work comp injury, just the lumbar spine and pelvis mostly. But she is translated on the left axis, her pelvis is translated left. And see, that kind of tilts her spine off to the right. She has what's called a right antalgic posture here. And from her thoracic spine up. Now again, like I said, we've already done her exam and history and everything. I've looked at her diagnostic testing. Let's go ahead and lay you on your stomach here for me now. Okay, Jennifer. Left leg is short by 1/2 inch in this position. Now when I bring it up though, you can see it gets even. That tightens up in your low back and your pelvis, doesn't it, Jennifer?
Yeah.
And she's got left sacroiliac joint subluxation right there. That's palpation is tender and sore. She's L5, L4, L3. All these are subluxated in the lumbar spine. In fact, the nice forward lordosis that she's supposed to have down here has flattened out from normal. You mind if I lift your shirt up, Sean? See, it's supposed to be a nice forward curve in here. Now you can see hers, because of the muscle spasm, is starting to flatten out in the lumbar spine. We call that a military spine. You usually see that in the cervical spine. Boy, that was a tender rib right there, wasn't it? You got several up in your mid-thoracic up here. Shoulders are tight a lot too, huh?
Yes.
Yeah, and that's really bad right there and right there. Whew. There and right there. Okay, lock your right leg straight for me and lift your entire right leg up. Okay, relax that one. Do the same on the left now. Now this left one didn't come up near as high. I would venture to say that that probably felt more difficult for you to lift on the left side.
Yeah.
That shows a left sacral deviation. That is an orthopedic test called sacral deviation test, and that means her sacrum, which is the middle triangular shaped bone inside of her ilii, which are plural for right ilium and then left ilium. But she has left SI joint subluxation, which I'm going to start adjusting first. Now, some of these will be a little sore at first, Jennifer, just because they've been out and you haven't put back in place yet. But that's okay. This will be one of those hurt so good things. Now I'm adjusting on her left sacrum, straight superior to inferior and posterior to anterior, to put that sacrum back in a better biomechanical relationship with the ilii on both sides, as well as the L5 vertebra that attaches to the sacrum. That's the L5S1 lumbosacral joint. And now I'm getting in her lumbar spine and pushing all the vertebrae back forward because hers have moved backwards in retrolisthesis. So we're going to adjust them back forward with a high velocity, low amplitude thrust, just like that. There you go. Keep breathing. Yep. The first one moved really good, but you're super tight everywhere else. Okay, your left leg that was short is now exactly the same length, and this should feel a little easier already in your low back. Okay?
A little.
There you go. Okay, let's turn you on your back now. Now, we do not do workers' comp cases here in this office. We do not do any insurance whatsoever in this office, so I'm not taking care of her on her workers' comp claim. Slide down this way a little bit. Yep, that's it. Slide down a little bit more and put both arms straight out to the sides, palms facing up. Slide down about a ½ inch more. Right there. Better. So these are going to be a little sore because your mid-thoracic is sticking out. Compensate for what's going on in your lumbar spine sacrum. There you go. You can relax your hands right here. Let me have this right leg. Just breathe and relax. That a girl. You should have felt that from your knee all the way up to your lower back. Let me have this one here too. That's it. Good. Okay. Now, let's sit you up, face towards Troy. There we go.
There we go.
Okay, you gotta relax. There. There. Okay, let's come over here on this one. No, you're fine. But right here, hit it this way. Let's get down here a little bit more, please. Until I tell you. Right there. Good. You're good. Slide up underneath that just a there you go. Let it lay flat. Don't want you to tilt. I'll get it in tightly from the side. Yeah, this is the go up the hill part.
Right. Going down is my favorite. Let's see if this is.
Oh, this will quickly become your favorite. Okay, there you go. I want you just to let your head go in my hands here and breathe through your nose. Keep your teeth clenched together. Not clenched, but just keep them together. Breathe through your nose with your right big toe. There you go. Just like that. Home run. Now, I know you felt that one all the way down, because I certainly did. Sorry about that. That's a heavy pin. Okay,
That makes you
Jennifer.
see stars.
Let your neck relax in my hands. There you go. Okay, same here. Let it go. There you go. Don't worry, I don't have any heads on my trophy wall yet. I won't start with you.
Yeah, that'll make you see stars.
I'll wake you up in the morning.
Is that normal to feel tingles in your fingers when you do that?
Yep. That's the nerves out of your lower cervical spine going down into your arms and hands. Let's come over here and stand in front of the mirror for me. Now you are going to be sore over the next 72 hours, I promise you that.
I'm a little dizzy.
That's alright. Close your eyes and bend your head forward and backwards. I'll make sure you don't fall over. And back to neutral. You hold your hands out in front of you like that way too much.
Mm-hmm.
Quit doing that.
Where are they supposed to be?
Quit putting your hands out like this.
Where are they supposed
That's
to be?
pulling your shoulders forward and your head forward. You're supposed to be behind your back and squeezing your shoulders together. Try that for a change. No, back here. Squeeze these together. Does that look better? See what's going on here? Okay, you can relax them at your sides. So here's your homework. See how you're forward and off to the right? We're going to pull these guys up and back. Head's going to come straight back. I want you to tilt to the left starting from here. Now tilt your upper body straight left.
There we go.
Just like that. Now look back at the wall behind you. I think you're just looking at the ceiling. Look at the wall behind you. Good. Okay, now try that very same movement again, just forward and backwards with your head. This actually should feel smoother than the previous one did.
It's less crunchy.
Yep, take a look in the mirror. So you got space on both sides here now, compared to this being so far over to the left, so you didn't have any space. So did you feel that all the way down in your lumbar spine when I adjusted you on this decompression adjustment, Jennifer?
Yes.
Good deal. What would you have to share with people about your very first experience here at Advanced Chiropractic Relief? Because you've been to orthopedics and surgeons and
It's intense.
medical doctors.
It's very intense.
Was my history and examination
Very
detailed?
thorough. A lot more thorough than a lot of the other doctors.
Really? Even the orthopedics that you saw?
Yeah.
Yep.
Even the surgeon.
Yep. Imagine that.
Put pins in my spine.
Uh-huh. So we're going to follow Jennifer up later on in the week, and I'll let her tell you how she's done here and if we've been able to help her avoid to have surgery. This is your Houston Chiropractor Dr. Gregory Johnson coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.